Thank you, Rubesh, and thank you everyone for joining us. I'm going to discuss something that's probably very new to many of you in an audience. Uh, if you were here yesterday in the Uveitis session, one of our colleagues, Dr. Jia Hunt, had discussed a little bit about this concept. So I'm going to bring you things. This is called metabolic imaging, how we can consider that for various retinal diseases and uveitic diseases. This is to look at how the change in metabolism of tissue, just at the retina, that can help with that aspect. By the way of disclosure, our University Stanford has received research funding from OcuScience, the manufacturer of the system that I will discuss. So many of us are here now in daily. Certainly, among the diseases that we try to conquer and help are leading cause, for example, macular degeneration, glaucoma, diabetic retinopathy. These are things that many of us are trying to fight so to make sure we preserve the vision for our patient. Certainly, uveitis is also among that group because it is the fourth leading cause of blindness. The number here, 20 billion, that's a very large amount, and that's just in the United States alone. If you look at it in a global worldwide, that would be a tremendous, very high amount of money. I would think that all of us do believe in the concept of early detection. For any disease that we discuss, it will be good if we can detect the disease early so that we can have timely intervention, we can reduce the cost to this aspect, and we can improve outcome. For example, certainly in diabetic retinopathy, that has been the concept, and we want to make sure that we prevent so the disease won't get worse, so the patient will not suffer from diabetic ocular complication from that. So this is the same concept that we would like to do. During the past few years, the pathway to mitochondrial dysfunction of eye disease had helped us to understand further the pathophysiology of diseases such as diabetic retinopathy, macular degeneration, as well as glaucoma, to the fact that many of these conditions start out with, after the certain factor, for example, hyperglycemia or aging, lead to oxidative stress and then mitochondrial dysfunction from that. What about uveitis? And certainly that's the topic that many of us are also interested in. Let's look at the mitochondrial stress. This can lead to apoptotic cell death, underlying pathology in a number of ocular diseases. However, prior to the cell death, which is apoptosis, mitochondria exhibit what we call impaired electron transport that can then lead to an increased oxidation of flavoprotein. So it is this concept of flavoprotein that we now focus on. The Ocumet beacon, which you will see shortly, is a device that measures the redox state of flavoprotein in the retina, and it helps us to detect the health of the retina, among other things. This is a cartoon that's showing what happened from the beginning. Oxidative stress lead to mitochondrial flavoprotein being produced, increased native fluorescence, and potential clinical metabolic abnormality. As you can see, there's a reduced flavins, and then when they activate, that's an oxidized flavin that we now try to measure with this aspect. Where is the mitochondria in the eye? So they actually look in different parts. On the left-hand side there, you would see the presence of mitochondria in the retina there, and on the panel B, that's where the stain using the vitamin C oxidase. On this panel on the right-hand side, between non-stain and stain, you can also see the presence of mitochondria in the optic nerve as well. So we know that in different parts of the eye in this aspect. The concept here is that we recognize that when the cell undergo mitochondrial stress early in the disease and before they commit to apoptosis, this is very important. The cell dysfunction, mitochondrial dysfunction, occur very early before the so-called apoptosis or cell death. So we definitely want to catch the disease at that stage. Most current retinal imaging, such as OCT, only show the structural abnormality of advanced disease. If you look at the scale on the bottom, from left to right, you see the mitochondria act in this aspect. That's mitochondrial dysfunction. That's relatively early. Most of the time at this moment, we as clinician scientists will see patients when they have vision loss of visual pathology, and that's where we would like to, right now seeing that. But we want to shift our opportunity. We want to take the patient earlier to see if we can detect it. So with this concept, again, early intervention in disease is indicated to maintain mitochondrial function with this aspect. On the right-hand side, you see a lot of the technology that we as ophthalmologists are using right now. We use fundus autofluorescence, we use fundus photography, the retinal tomography. Many of that corresponding to when visual pathology has already occurred, with blindness occur already. What we would like to see if we can move it more to the left, where we want to detect the disease earlier. So here is where this new device come in and this new technology to look at mitochondrial function as a way of look at the metabolism. So-called the mitophore modality from this instrument can help to assess eye disease earlier. This is the key fact, earlier, and quantitatively measure those diseases over time to monitor the progression. That's what we want, because right now we're more on the right. We want to bring all of us close to the left-hand side so we can detect the disease earlier. This is a very simple cartoon to illustrate to us what we're looking at right now. Right now, certainly all of us are familiar with OCT. This is the reflected beam from the incident beam going to the eye, reflected beam coming out for fundus images. When we talk about other technology, for example, when it's involved absorption of light, and that leads to, for example, fundus autofluorescence, and then this product, fundus protein fluorescence, and the FLIO, this aspect here. So that's a very simple concept, how we distinguish this from other aspect from there. This is the device. It's called the Ocumus beacons. It's one of the latest technology that we are now enhancing to assess the retinal tissue aspect. So the light, the blue light will go in with the green light emitted out. That's what we capture from that. And then it's generated for us. We gather the data, we then synthesize the data, analyze it, and then generate a report, which is so-called the FPF score, and we're between 15 up to about over 100, depending on disease status of this aspect from there. On the left-hand side in that box, we have also the diseases that have been tested: diabetic retinopathy, AMD, pseudotumors, central series retinopathy, retinal dystrophy such as Stargardt, primary open-angle glaucoma, because it's also capture how the optic nerve function. So in this type of condition, when this oxidative stress, before the setup occurred, we will see an increase in the fundus protein fluorescence of this aspect, and that's so-called FPF for this aspect. That's what we are detecting. This is a recent study that looked at over 450 eyes of this aspect, all have different stages of macular degeneration, from early to intermediate to geographic atrophy to neovascular AMD, to compare with the healthy control. So basically, this particular study looking at what kind of appearance on the FPF for a number of this type of neovascular AMD or GA or different thing. So they showed that the different type of AMD, different stages of AMD will have different FPF imaging, as you can see from the lower level there. So based on that, they are now using that type of FPF to monitor the patient before any other invasive techniques will be done to do that. What about, obviously, as clinician scientists, we also like to ask the question, so pictures are beautiful to look at, but how functional are they? How good can they be, and what can we do to understand how to use it? Just like when Dr. Ting showed earlier today, when we were using wide-angle imaging, it's nice to look at image, but how functional it is, what can it do to help us in the clinical management of the patient, and that's the most important part. So in this particular case, we also see how it's functioned, among other things, diabetic macular edema. And this is a case of a patient with significant macular edema from diabetes. At day 0, when this, you can see from there, in that aspect, because of the presence of macular edema, the clinician decide to inject triamcinolone to this aspect. So within 1 week or so, you would see a reduction in the FPF about 7%. So you can look at the beginning about 88, and it go down to about 1 week later to about 82 aspect from there, so about 7 points from there. So at this moment, because of the way different clinicians follow different patients and things, so at this moment, we decide to add anti-VEGF, any particular type that you like, and then you follow the patient for about 3 months later. Here, you now can see that the FPF actually now reduced now to about 24% in this aspect from there. So we do see that this aspect. And so you say, so what? We can also see in OCT as well. But here's the point with this aspect. All of us know who manage patients with retinal vascular disease like diabetic macular edema know that OCT is not always predictive of visual acuity, and oftentimes OCT change, we see it first, and then subsequently we will see changes in the visual acuity because it lag behind. So one of the questions we ask is that, can this FPF help to predict visual acuity earlier before? So would you decide when should you continue to treat an eye, for example, or is it already get to the point where it's futile? No matter how many more injections you get, how flat you get the center, the foveal center, it will not make a difference. So in this particular case, it seemed to be that the FPF seemed to correlate with visual acuity improvement better. And in fact, FPF may detect the metabolic improvement before the structural improvement occurred. So this would be very helpful in the case where you would decide whether or not you should or should not move forward to treat with additional aspect from there. And here the FPF mirror the visual function change seem to be better than OCT thickness than that aspect from there. And again, this might be able to help us as a tool that we as clinician scientists will be able to do with this aspect. So now what happened in uveitis? This is a field that many of us in the field very much attached to in this aspect. So could FPF serve as a biomarker for early detection of inflammatory activity? So we will show you 3 cases, and I'll see if I can explain this. This is the work done by 2 of our current fellows, that Mohammed and Amir. Some of you in the audience may recognize at least Amir in this aspect from there. And this is the work that has been gathered by the team in this aspect, because this is the first time that this type of FPF was actually being used and to manage to monitor uveitic condition. So we start with 2 cases. This first case is A29, so you may call it birdshot. And this is a patient that we, using very functional endpoint and also using some of the imaging thing, decided this patient had very aggressive condition. And as you can tell from the treatment, we were using adalimumab 40 milligram every week and also put methotrexate on that too. So right away when you look at regimen, you know that this patient received more than the typical dose of that. And so we determined that this patient had Graves' disease. So the upward, you see the ICG and you see multiple hypofluorescent dot in this aspect. And then when you do the FPF, you will see that below there, you will see the number much greater than the 35, which is the upper limit of normal in this aspect from there. So fine. This is the patient, we figure out that the patient have active disease based on functional tests, and we tested that, it is fine, that we see the change in FPF as we expected. This next patient also had birdshots as well. However, this patient, so far from our clinical knowledge, we thought that he was stable, that she was stable, so we just keep the patient only on adalimumab every 2 weeks and methotrexate 10 milligram, this aspect from there. So we think that this patient who also had birdshots may have a lesser disease. However, the ICG are as expected. But when we look at the FPF, we show that the number actually higher than the other patient. So now, with this additional information, we are pondering to see whether our clinical judgment is, could it be modified further? With this additional information, can you now determine whether you should treat the patient further or not? And certainly we don't know the answer yet because we're ongoing looking at this process right now. The third case is a patient with B51 positive, and this is a patient that you can see from the upper colorful funded photograph. Dr. Tin just mentioned to us that cannot really tell us much, so you have to look at the fluorescein. But you and I, when we look at the fluorescein like this, by the time that we look at the fluorescein, we see significant vascular leakage already, and obviously the patient will most likely have functional loss. So our question is that, can we detect the disease earlier before you see all these changes on the fluorescein? And so if you were to look at the FPF, you will see that the number is quite high. So the question would be, could we able to use this to detect even earlier before the change in the fluorescein angiography? So in summary, what I've shown you is a new concept, at least for the field of uveitis with this, that look at mitochondrial oxidative stress, which is the key factor in many retinal diseases, including AMD, glaucoma, and diabetic retinopathy. And in this case, using this new technology, we measuring damage due to metabolic stress for this aspect from there. And our disease certainly have pre-structural damage in this aspect from there. So finally, we want to find out whether this technology can help us to manage our patient and vascular disease better or not. I do know we have a little bit of time, so that's why I'm taking a little bit longer time to do it, but we make sure we take on time on this aspect. And finally, it's certainly for me to be able to present like this, certainly we owe the work to many of our colleagues, and this is our current team from Stanford. Some of you may recognize some of these people. We're very proud of this moment, 10 different countries representing right now in our teams this year, and we have great time together with many of our current players. And then finally, if you are interested further in this, please join us in Rio de Janeiro this June. We will have our International Ocular Inflammation Congress. We'll be in there. Looking forward to seeing everyone. Thank you.
So I think that's a very wonderful talk and something the insight into the future which might be helping us some functional imaging if I